Sir, when should we consider seeking professional help for an elderly person's mental health?
There are a lot of points to be considered. When you are familiar with a person, if you notice any change in the usual behavior of that person, you have to note it, because he was usually mingling with people, he was talking coherently, he was talking very efficiently, and he was dealing with things. And now we find that during these days there is some change. If you find any change in the behavior or attitude or cognition of that person, you have to report it to a health professional. For example, he says, I am losing my memory, I am misplacing things constantly, I don't like meeting people. When somebody comes to our house, I am thinking, when will he leave? I want to sit alone. Like that, if you find any difference in the previous behavior of that person, you have to note it. Then, if you find declining physical ability of that person, previously he was moving well, but you find something in some difference in his walking style, some difference in his talking style, even in his sleep habit you find some difference. Previously he was going to sleep by 8:30. Now he is remaining awake for long hours and calling you in between and disturbing your sleep as well. So there is difference in his sleep, and he is always thinking and telling that I am of no use nowadays, then how should I live long, like that. So here I want to reiterate on one thing about sleep of the old people. It's a very important fact to be considered, because you have to sleep in absolute darkness for 8 to 9 hours, especially as far as old age people are concerned. Even younger people are supposed to sleep long hours in darkness. What happens if you are not sleeping in darkness, a specified darkness? Because in darkness there is a hormone called melatonin is secreted, which is very, very important for all the vital activities in your mind and your systems. It accelerates your mood, it maintains your mental health, it even controls over your physiological activities. So melatonin starts getting secreted at night, probably around 10 o'clock in younger ones and a bit earlier in old people. So when you sleep in absolute darkness without any light, the melatonin will start functioning and getting secreted. So in absolute darkness it will be continuously going on uninterrupted till the morning. By that continuous uninterrupted supply of melatonin, you will be getting revitalized, you will be energized, you will be having good mood, good memory, and good physical well-being. But you are not getting that proper sleep, or rather you are not getting a regular supply of the melatonin due to interruption in the light. For example, you are getting at 12 o'clock and switching the light on for reading something, or you are reading on the mobile phone. You are switching all the other lights and you are reading on the mobile phone with that blue light. That's also an interruption. So by that interruption, your melatonin secretion will be interrupted, and that will affect your mood in the morning. You will be drowsy, you will not be getting interested in anything, you will not be able to do the routine work that you are usually doing. So adequate sleep is very, very important for the old people. So when you are nursing old people, see that the person is sleeping in darkness. Ensure darkness for that person. Probably for convenience you will be putting some light on. That will be unhelpful for his health. So find alternatives. You can put some red light or something like that. It's not harmful. Otherwise be ready with some emergency light if it is required. Switching off the other lights when he is sleeping.